So my YouTube channel is called Levelheaded Mind, which is also the name of my private practice. And it's about basically educating the public on various mental health topics. This month, I'm focusing on mental health awareness, of course, because it's Mental Health Awareness Month. And so I'm doing some interviews with different practitioners and people in the space of mental health.
Mhm.
However, I typically focus on mental health care treatments, different medications, and things that doctors and practitioners don't have a lot of time to share with their patients. You'll find on my channel, so that way they can make an informed decision about about their care and about their treatment.
Beautiful, beautiful. So I'm putting all the links to her channel. It's gonna be in the description box below and it should pop up to the top. But let's get right into this interview. You mind telling us a little bit about yourself, who you are, what's your professional background?
Sure. So I am a psychiatric mental health nurse practitioner. However, I started my nursing career back in 1999, and that's when I got my licensed practical nursing degree. And I
Mhm.
guess it really started before then because when I was young, my grandmother had to move in with us because she had a stroke.
Okay.
And so I cared for her and helped my mom care for her. And she was the one who I was 12 years old and she told me, and she went like this to my nose after I was reading her a verse from the Bible. And she said, you'd make a really good nurse. And I said, really? But it stuck with me. And in my last year of high school, the vice principal actually put me into a work study program where I did half of the school day. Me and another student went to the hospital to work. And so I really started out then and worked as like a candy striper, like a nursing assistant role. And then that is what really opened my eyes to nursing. Then I went back to school at that time to get my LPN. And I was an LPN for many years, for about 13 years before I went back for my RN. And going back for my RN was actually a journey in and of itself because I was living in Pennsylvania at the time, moved to Florida, and it was in that transition of moving that I realized that the LPN role was very limiting. I moved to South Florida, as south as you can go down to the Florida Keys, and there weren't many opportunities for LPNs, at least at that time. And so it pushed me to go back to school and become an RN. And in that journey, I started to reignite this passion that I've always had for the role of nurse practitioner. However, I didn't really know I wanted to be a psychiatric nurse practitioner until like those last 5 years of my RN career that I really started focusing in on mental health care and opening up my eyes to the needs, especially down here where I live. There are very limited resources for mental health. And I was working at that time at a crisis stabilization unit and seeing a lot of patients coming in with mental health ailments and needing help and having a lack of resources, but being put on waiting lists, etc., in order to get that help. And so that was the push for me to go back and become a psychiatric nurse practitioner. And so here I
Wow.
am.
Well, here you are. I really appreciate you taking us on this journey with you, because there are a lot of people who realize that there is a great need for help in the space of mental health. And it's beautiful to see nurses such as yourself really leveling up and scaling up in your credentials so that you can help more people in just more of an in-depth way.